Need, demand, supply. We use these terms frequently when talking or writing about healthcare, but their meaning is not always clear. Why does this matter? It is important to have clear definitions of these terms when making or discussing healthcare policy. For example, suppose a policymaker wants to reduce unmet need for healthcare. Unless she has a clear understanding of what is meant by need for healthcare, she can't identify who to help. In this short video, we offer working definitions of need, demand, and supply, and explain how these overlap, using a simple diagram. Here's a Venn diagram showing need, demand, and supply. This generates 7 distinct areas. Let's first look at supply. The supply of healthcare includes all types of services that cure or prevent disease. It does not include unpaid care provided by friends and family, or social care provided by paid care workers or by volunteers. The supply of healthcare varies over time and across different parts of a country. Not all the treatments a healthcare system provides are proven to be good value for money or cost-effective. Some types of care have never been properly evaluated, so we don't know for sure if they're effective or good value for money. Yet the healthcare system provides them because they seem to be appropriate. No treatment is always cost-effective for everyone in all circumstances. This is because cost-effectiveness depends on the health condition, as well as what the treatment is compared to. Some supply of healthcare is not used. This is represented by Area 7 in the diagram. This unused supply happens when the healthcare system has too much capacity. This situation can be the result of a choice. For example, hospitals may keep some beds free to manage spikes in demand. Or unused supply may not be due to choice, but due to waste, such as overstocked vaccines or missed appointments. In both cases, the main reason for unused supply is that healthcare providers are unsure about how many people will need care, and when they will need it. Let's take a closer look at need. We define need as the capacity to benefit from healthcare. In other words, if the person were to access healthcare, their health could be better than it would otherwise be without treatment. By healthcare, we mean treatment, preventative or supportive care that can benefit someone's health. Need is only for treatments that are good value for money, or that doctors or nurses consider to be clinically appropriate. Some of the need circle overlaps with supply. If the care that is supplied is appropriate or cost-effective, then need has been met, as depicted by areas 4 and 5. Some of the need circle does not overlap with supply. This is unmet need, as depicted by areas 1 and 2. Now let's look at demand. In simple terms, demand occurs when someone requests healthcare. The request might come directly from the person who needs care, or someone else might demand a service on their behalf, for example a family member, a friend or a doctor. The decision to demand healthcare depends on the expected balance of costs and benefits of care. Costs are not just about money. The risks of harm or side effects from treatment are also a type of cost. Then there are psychological costs, such as fear of receiving an unwelcome diagnosis. Sometimes demand is met by supply, as depicted by areas 5 and 6. Area 5 also overlaps with need, so care is appropriate, and may also be good value for money. In Area 6, however, there is no overlap with need. The patient is receiving care they do not need. An example might be a person stuck in hospital who is ready to leave, but is still waiting to be discharged. Sometimes demand is not met by supply, as depicted by areas 2 and 3. In Area 2, there is a need for care, but care has not been received. This could be because the person is on a waiting list for treatment. In Area 3, there is no overlap with either need or supply. For example, a person asking for a treatment that is either not cost-effective or that the healthcare system considers inappropriate, such as cosmetic surgery. In Area 4, need is met by supply, despite not being demanded. This type of care is where prevention of future ill health care occurs, for example, water fluoridization to prevent tooth decay, or screening programs to detect the risk of developing an illness.